Hey guys, this video is going to serve as an introduction to the topic of depression, what it is, how to diagnose it, some of the treatments for it, and then lastly we're going to talk about the mnemonic SIG-E caps, which is, a lot of you will know, it's kind of like a quick and dirty mnemonic used by providers to screen for depression in a patient or to educate the patient about what their depression might entail. We'll get to that in a second, but first of all, we need to define what depression is. A lot of people think they know what it feels like to be sad, or think they have an idea what depression is, but it really is this clinical syndrome of just being really down or depressed or having a really reduced amount of energy and a really low self-esteem and low mood. Now, it depends on which body you listen to as far as your diagnosis, or the criteria for diagnosis. But the DSM-IV, which is largely regarded as one of the best diagnostic manuals for psychiatric disorders like this, says you need two things. You need to have a depressed mood, and not like because of like bereavement or like a 6-month grief period after someone dies or something like that, but like a persistent depressed mood that doesn't necessarily have a single identified cause, like the passing away of a loved one or something like that. And the second part is anhedonia. Now, anhedonia is something that comes up all the time on boards, not necessarily always with depression, but with other disorders as well. And that is this concept that you don't get pleasure from things that would normally be pleasurable to you. So like if you were a world-class guitarist and then you went into this slump where you hate, like the guitar gave you no pleasure, like you picked it up out of habit and then just put it back down just because it's not doing anything for you, that would be like anhedonia. The ICD-10, which is a coding system that a lot of providers use, are going to be using soon, adds a third thing onto there, and that's decreased energy. But in any case, 2 or 3 of these signs in someone that you are suspecting depression, well, that kind of confirms your diagnosis of depression. Again, you want to look for like a single identifiable cause. People can be grieving, kind of touched on that earlier, but they call that grief process bereavement, and that can last up to 6 months and still normal after up to 6 months. And then after that, if someone's still down after 6 months, then you kind of start talking about, is this person actually depressed, and they're just going to be masked by grief. But enough of the definition and the diagnosis. The treatments for depression, a lot of people are familiar with like SSRIs, selective serotonin reuptake inhibitors, things like Zoloft and Prozac and things like that. There's some other drug classes that are pretty helpful. One thing I want to talk about is electroconvulsive therapy, or ECT, which is actually where they induce a seizure with running electric current through your body. It sounds barbaric, but you're well sedated when you undergo it, and it's actually great as a last line therapy for people with these major depressive episodes. It actually works. And then the other thing I want to touch on about treatment is that studies have shown, or a study in particular has shown, that exercise can be as effective, if not more effective, than being placed on an SSRI. So if you live in a sedentary life and you're starting to feel down and you're watching this video because you're curious about why you're feeling down or whatever, try some exercise, 30 minutes of vigorous exercise a day. If you're a provider, or a student that's going to be a provider, make sure you encourage exercise, because it's not just about burning calories and building muscle mass and preventing falls. It's also about psychiatric health. Who knew? Okay, and now the last thing I want to talk about is SIG-E caps. And what am I saying? SIG-E caps. And I'm only writing like that for space-wise. But you'll see in a provider's note, they'll just write like SIG-E caps on a line, and that's kind of like their language. So you should know what that means, and we're going to go over what that means. The S means sleep changes. The I is interest. It's kind of like the anhedonia, like we talked about. It's a decreased interest in things. The G is guilt or feeling like worthless. So increased guilt or just feeling like no one wants you around or you're the cause of everyone's problems. E is energy, which we kind of discussed earlier. The C is going to be cognition or concentration. It's like focus, going to be decreased. So these people, if you saw this in a teenager, they're going to be doing poorly in their school. A is for appetite. A depressed person does not want to eat. The P is for psychomotor. And this one's kind of different, kind of trickier than the other ones. What psychomotor means is it can be anything from anxiety to lethargy, but just there's something, they're not their normal self psychomotor wise, like they are either really ramped up or they're really slowed down, just something's different. And S, last one, is suicidal thoughts, which a lot of people think about in terms of depression. Most people that commit suicide are depressed. So SIG, E, CAPS, when you hear someone say that, this is what they're talking about. These are the things you should look for. If you see a patient who's exhibiting these, some people say like 4 out of these or whatever, then that half of them, then you should think about testing this person for depression, looking for that diagnosis, and maybe starting them on a trial of something. But yeah, sleep, interest, guilt, energy, cognition, appetite, psychomotor symptoms, and suicide. Those are the big things to look for in someone who's depressed. All right, that's a introduction to depression. Thank you.